More than 1 year into the pandemic, we're seeing troubling trends when it comes to COVID-19. New York and New Jersey topping the nation in new cases, variants now accounting for a majority of those cases, and a substantial rise in children infected with the virus. All this as New York City relaxes its rules when it comes to public schools. So to dig deeper on this and talk more about the questions you have this morning, we have New York City Health Commissioner Dr. Chokshi with us this morning. Commissioner, good morning and thanks for being here.
Good morning. Thanks for having me on, as always.
So let's begin, Commissioner, with the variants, right, which are reported to now make up 80% of the cases in the city. The homegrown variant, the New York variant, followed by the UK variant dominating here in the city. What new information have we learned about these variants here in the city?
Yes, this is a trend that we're following very closely. First, we remain at too high of a level of cases across the city. Generally about 3,500 new cases each day. And as you said, our latest laboratory data indicates that almost 80% of them are driven by the new variants. Two in particular, B.1.1.7, first identified in the UK, and then B.1.5.2.6, which was first identified here in New York City. Both are known to be more infectious, which is why we have to be even more vigilant in following precautions to curb the spread of the virus.
Right, and that's why many more people should be getting the vaccines. But is there any indication, Commissioner, that the vaccines are not working on these variants, these two in particular that are dominating in New York?
This is something that we're following very, very closely, and we do not at this point have any indication that the vaccines are not working against those two variants. We believe that the vaccines offer a good protection against them, and particularly against severe disease, what results in hospitalization or needing help with breathing. So that's good news. There are other variants, particularly the ones that were first identified in South Africa and Brazil, which have stronger evidence for being able to evade the immune system. Those are still at relatively low levels in New York City, but they're ones that we're following very closely.
Understood. You know, nationwide, we're seeing a dramatic rise in cases among children now. So where does things stand right here at home? Why are we seeing this rise in cases, particularly in a younger age group? I was asking a doctor yesterday, is it because the older population is now majority vaccinated?
Yes, that is part of the explanation. But let me start by saying, as a doctor and as a parent, any cases in our children, we want to be able to prevent. In New York City, we're not seeing the same precise trends that we're seeing nationally with respect to cases increasing in children. So let me just be clear. We follow case rates by age group, and we're not seeing those case rates having increased over the last few weeks or even the last few months. They've generally been tracking along what they have been over that time period.
And I'm sure parents like to hear that, but is there a particular age group then, Commissioner?
Yes, sorry, that's what I was about to get to. We are seeing that there are some increases in cases in younger adults. And we think that this is partly driven by the fact that older adults have been more likely to get vaccinated, which of course is a good thing because we want our seniors to be protected, and that the virus may therefore be preferentially getting to people who don't have the protection that vaccination affords. This is why it's critically important for everyone to get vaccinated when you're able to.
Understood. And that brings me to schools then, right? The mayor and schools chancellor announcing that on Monday, public schools will have to close for 10 days only if 4 or more cases in separate classrooms are confirmed in a 7-day period. I want to play a snippet from yesterday and then get your take.
For individual classrooms, we'll still have a very strict closure rule. 1 confirmed case means going remote. After 10 days, the classroom comes back. For the entire school, if there are 2 cases or 3 cases in a week, that will lead to an increase in testing, but not a closure. If there's 4 or more cases and they're in different classrooms and can be traced to a known exposure within the school, that's when there will be a closure.
To be clear, classroom quarantines will continue if a positive case is identified in a classroom. We must still assume that everyone is a close contact in this case.
All right, so I know you said locally you're not seeing the rise in cases in children like you are nationally, but are we relaxing the rules in schools too soon?
Well, we've created the gold standard for health and safety in our schools. And the philosophy is very simple. We want to keep schools open by keeping them safe. And this starts with what I think of as a stepped approach. We have multiple layers of precautions of safety, masking, distancing, ventilation, testing. That applies to all schools across the board every day, every week.
Yeah.
Then if we do see cases in schools, we start by increasing testing to gain more visibility about what's actually happening. We have the ability to quarantine classrooms to make sure that people are protected if they've been exposed to the virus. And then in some cases, we do have to close schools as well if there's transmission that's occurring within the schools. And so, the new policy allows us to bring to bear all of those tools.
Right.
But also to make sure that we have stability along with safety, because we know that's so important to parents and to children.
Absolutely. Safety is key and paramount here for so many things, right? And Dr. Fauci this week on our air said some places need to hold off on reopenings or we'll see what he's describing as a potential fourth wave. Do you think, Commissioner, that the continued relaxing of rules and reopenings will drive numbers even higher as the weather gets warmer right here in the city?
I am also concerned about this, and we have to modulate, the pace of our reopening carefully. We cannot give this virus any ground. It has shown us time and time again that it will find, the weaknesses in our defenses, and so we have to maintain them at as high a level as possible. We still have 2,500 people hospitalized with COVID-19 across New York City. So we have to remain vigilant and follow what I call the safe six. Keep wearing your mask, keep your distance, stay home if you're feeling ill, keep washing your hands, get tested. And, we're seeing that some people are not getting tested
Right.
where they have been before. So we want people to continue getting tested. And then most importantly, get vaccinated because it is the best protection that we have.
Absolutely, and that brings me, a nice segue right to the vaccines, right? Because there are reports right now of adverse reactions to the Johnson & Johnson vaccine across the country. What do you know about this? Are we seeing any issues with that vaccine in particular here locally? I think you actually received that one, correct?
That's right. I received the Johnson & Johnson vaccine and the mayor did as well. And in answer to your question, no, we haven't seen any particular signals related to the Johnson & Johnson vaccine. We know that it's been tested very broadly, now been administered to hundreds of thousands of people and generally has been safe. So we coordinate with the CDC on the reports that they're receiving. And anytime something changes, we will be communicating with New Yorkers. But for now, I feel confident in being able to convey that the 3 vaccines authorized by the FDA are safe and effective, and most importantly, they save lives.
This week, Commissioner, the rollout of the mobile vaccine buses or vans, whatever you want to call them, right? That was impressive to see in communities. But there's also this shortage now of the Johnson & Johnson vaccine affecting not only New York, but states all across the country. Will this at all impact that goal of 5 million people vaccinated in New York by June?
We're keeping that goal, and we're making good progress to get to it. Over 2.5 million residents of New York City now have received at least 1 dose of the vaccine. So we're making progress. We do rely on supply from the federal government, and so we have the capacity in New York City to absorb as much vaccine as is coming our way. So we'll watch the supply trends carefully, but for now, I still do believe that we'll be able to meet that goal.
We're out of time here, Commissioner. I want to squeeze in one last thing, and that is for people planning anything in New York City this summer. Your advice then, because pools are opening, beaches are reopening, but stay safe, because I'm listening very carefully to what you're saying in the reopening. What's your advice to families?
My advice is we know what works to keep people safe. Outdoors, better than indoors. Wearing your mask consistently and properly is better than not. And smaller gatherings are always better than larger gatherings. So let's keep following, those common sense precautions because we've all been through too much over the past year.
Agreed.
So vaccination gives us a chance to finally be in the home stretch of this marathon. Let's take it, but let's stay safe while we're doing it.
Commissioner Chokshi, always appreciate your voice and your knowledge on this issue. You're welcome back anytime. Thank you.
Thanks so much, Dan.